So I came to Bay State in 2006 as a practicum student. From there, I continued on with my internship, which I finished up in 2007, and then officially started working here in 2007. Sort of through my time here at Bay State, in addition to being an intern, I was a full-time fee-for-service clinician for many, many years. I helped to coordinate a program and partnership we had with Habit OpCo, which is a methadone maintenance treatment program. I also worked in Plymouth Star, which is one of our residential programs, different name today, as both a clinician and a program director. I've also worked in our intensive outpatient programs and our outpatient clinic in Quincy, and from there sort of went through helping as the assistant director in that clinic, as well as moving on to the vice president of adult services, and then taking on some of the added responsibilities with our rehabilitative justice programs, which brings me to today as the chief operating officer. You know, the work that we do is really hard on a good day. And for me, it's really about the people around me, the culture of the agency. It gets us through the really tough days, and is certainly the support system that I need to be able to do my job. It's nurturing, it's supportive, and honestly, it's a lot of fun to be around most of the time. So, you know, I've been really fortunate to, in the last probably 5 or 6 years, really become more a part of those centers. And for me, what has always struck me is the transformation that I see the participants go through. Hearing their stories, what's wonderful is they do recognition ceremonies a couple of times a year, so you really get to hear participants talk about what it was like when they first walked in and usually not super happy to be there, and then really where they end up at the end when they're transitioning out, and to hear how supportive the centers are, the staff are, how much they feel respected through that process has really been meaningful to me, and certainly I think speaks to the good work that we're doing, but also how we really can impact people who are coming into our programs. I think for me, something that has always struck sort of a chord with me is that the "this is not my job" concept is really not part of the language or the culture of who we are here. You know, everyone pitches in, everyone lends a hand. Doesn't matter if that's in your job description or not. It's really about the greater good. You know, I've seen our CEOs, unclogging toilets. I've seen our CFO shoveling the front walkway, and I think every single member of the senior management team has answered the phones, checked clients in at some point along the way. It really is about the team, and it really is, I think, supportive to everyone, top down, bottom up, to know that everyone is here to support you. Everyone here is, going for the same common goal and really supporting the folks that are coming into care.